in.
Hi, my name is Jessica. I'm going to be your student nurse today. I'm going to go ahead and perform hand hygiene, ensure privacy. Can I confirm your name and date of birth?
Britt Sutton, January 27th, 1989.
Perfect. Okay, and can you tell me what brings you in today?
Just a well check.
Okay. Can you tell me where you're at?
The hospital.
Perfect. Okay, and can you tell me who the President of the United States is?
Joe Biden.
Perfect. Okay, so my patient is alert and oriented ×4. He was able to tell me his name, where he's at, why he's here, and he's oriented to time. He knows that the current president is Joe Biden. Okay, so and then just my first impression of my patient is he is well groomed and put together. He is dressed appropriately for the weather and looks like he's conscious and coherent. So I'm going to go ahead and the doctor has ordered that I do a full body assessment today. So I'm going to do just that. I'll start at your head and we'll just work our way down your body, okay?
Okay.
Perfect. Okay. So I'll start with his head assessment. I would be wearing gloves for this, and what I would do is just palpate. I would feel for any bumps, lumps, lesions, any patches of hair that are missing, anything like that. Everything feels good and symmetrical, just the way it should. His face is symmetrical. I don't notice any lesions or any skin problems that he's got. So I'll go ahead and do your eye exam. Okay, and just looking at my patient's eyes, if you'll just look straight at me. Perfect. They're about a 6 on the my measurement, 6 millimeters. All right, so what I'm going to do is just have you look straight at me. I'm going to flash my light. Perfect. So this eye responded one more time, and then this eye responded as well. They both constricted with the light. Same thing on this side. Perfect. Okay, this one responded first, and then the other one responded as well. All right, so what I'm going to have you do is if you'll just look at the wall behind me. Perfect. Look at my pen, and then look at the wall behind me again. Perfect. So his eyes accommodated as well. They constricted looking up close and dilated looking far away. All right. And I'm going to go ahead and just inspect your ears. Ears look good. No redness, no discharge. Everything looks good with his ears. They're symmetrical. Do you have any hearing problems?
No.
Perfect. Okay, great. So I'm going to do a little hearing test with you. If you'll just stand up in front of me. Perfect. Okay, and I'm going to whisper a word behind you on each side if you'll just repeat it back to me.
Bird.
Yep. Okay.
Dog.
Yes, perfect. Okay, so you can sit back down. All right. Very good. All right, so my patient is good at hearing. He didn't seem to have any issues hearing the words that I whispered behind him. Okay, so I'm going to go ahead and just take a look at your nose. My patient's nose looks good. It's symmetrical. If you will just hold one side and breathe in for me. Very good. And the other side. Very good. Okay, so both nostrils are patent. You can breathe in through both of them. And I will go ahead and take a look in your mouth. If you'll open big, say ah for me.
Ah.
Good job. All right, my patient's teeth look good. Oral mucosa is nice and pink and moist. Everything looks as it should. Do you ever have sore throat, anything like that, any drainage? No. Okay, perfect. And then what about your nose? Any congestion?
Never.
Perfect. And I also meant to ask you with your eyes, do you wear contacts or glasses?
No.
Perfect. Okay, great. Okay. So, and then do you have any crowns, bridges, anything like that in your mouth? Okay, great. All right. So, we're going to move on down to your neck. So I'm just going to make sure his trachea is in the midline. And then can you turn your head to the left for me? Perfect. No jugular distension on the left, and then to the right. Perfect. No jugular distension. And I can see my patient has full range of motion in his neck. He's able to move it both ways for me. And then if you'll just go ahead and swallow for me. Perfect. Any trouble swallowing?
Nope.
Great. Okay. Perfect. All right. So we're going to go ahead and we will move on. I'm going to listen to your heart. Well, actually, first I'm going to listen to your respirations.
Okay.
So I'm going to do 4 on the front, and then I'm going to move to the back and do 4, and then I'm going to do 1 on each side.
Okay.
Okay, and I'm just going to start at the, I guess I'll start at the upper right. When you feel my stethoscope, take a deep breath in, deep breath out. Very good. All right, I'm going to do 1 on each side. Very good. Okay, and if you'll just kind of turn that way for me, I'm going to do the back. Very good. All right, everything sounds good with your lungs. While I'm listening, I guess I'll go ahead and do your cardiac as well while we have the stethoscope out. All right, so I'm going to listen to his heart as well, and I'll tell each point that I'm at. All right, so we'll start with the aortic. Go over to the pulmonic. Erb's point. Tricuspid, and the mitral valve. Right. Everything sounds good. Okay. And have you had any trouble, any cough, anything like that? Okay. So if my patient were having a cough, if he had any sputum that he was coughing up, I would go ahead and educate him on the cough and deep breathe. So for that, what you would do is just turn your head, take a nice, or get a real good cough out for me. Very good, and then a deep breath in. Very good. The other thing I would educate you on would be the incentive spirometer. So I would just tell my patient that this is the incentive spirometer. What you're going to do is take a deep breath in. Through this, there's a little ball. You're going to let it hover here for about 2 seconds.
Mm-hmm.
And then out. This is to keep your lungs nice and open. You want to do this about 10 times an hour. So when a commercial comes on, if you want to just do this during commercial breaks, just don't do all 10 at once.
Okay.
Perfect. Okay. All right. And then as far as your heart goes, do you ever have any heart racing, anything like that? Okay, great. All right, perfect. All right, so what I'm going to have you do now is just lie down for me. I'm going to listen to your stomach.
Okay.
Okay?
Like this?
Yep, that's perfect.
Okay.
All right, are you having any stomach issues?
No.
Okay, great. All right, so I'll start in the lower right. Go to the upper right, the upper left, and the lower left. And then I also listen with my bell for any normal sounds of a bruit, any whooshing. I don't hear anything there. Everything sounds good. All of his GI sounds sound normal and they're regular. He's got sounds every couple of seconds, but not excessively. And are you able to use the restroom?
Mm-hmm.
Okay, perfect. Bowel movements are normal?
Yep.
Great. Okay. What about urinating? Are you able to urinate without any issue?
Yes.
Perfect. Okay, great. All right. So we done that. All right. So our last thing we're going to do is your musculoskeletal exam. I'm going to have you sit up for me and just hang your feet over the bed. Very good. All right, so I'm just going to assess your range of motion and your strength, okay? So what I'm going to do is just have you go ahead and lift this arm up for me. If you'll go ahead and flex it in. Perfect, and out. Very good. All right, one more time. I'm going to give you some resistance. In, flex, and extend. Very good. All right, same thing with this wrist. I'm going to have you flex your wrist up. Very good, and extend it down. All right, one more time. Up and down. Very good. Okay. Go ahead and flex and extend. All right, one more time, flex and extend. Very good. Okay, same thing with your wrist. I'm gonna have you flex and extend and flex and extend. Very good. Okay, we're gonna come down to the legs and do 2 lower extremities as well with this. So I'm gonna have you flex and extend and then flex and extend. Okay, lift your foot up. We're gonna do your ankle as well. Go ahead and flex and extend and flex and extend. Okay, I'm gonna come to the other leg. Go ahead and flex and extend. One more time. Okay, do the same thing with your ankle and flex and extend. Okay, flex and extend. Very good. All right, and I'm gonna go ahead and check for any edema here as well. So I'm just gonna work my way up each extremity and make sure I don't feel any edema. My patient doesn't have any edema or swelling. Okay, very good. All right, while I'm doing this, I'm gonna go ahead and assess your capillary refill as well. Okay, capillary refill is under 3 seconds. And I'm gonna assess my patient's pulse too. So I'll go ahead and do his radial pulse bilaterally. It's a +2 on the right. +2 on the left. All right, I'm gonna come down to the posterior tibialis and do that. Posterior tibial. There we go. It's +2. Okay, +2. And then I'll assess the dorsalis pedis. +2. And +2. Okay, so I'm gonna have you stand up for me. All right, I'm just gonna assess your balance. If you'll back up a little bit, sorry. There we go. Okay, so I'm gonna kind of hold you here. If you'll close your eyes for me. And we would do this for about 30 seconds. I'll make sure my patient isn't swaying and doesn't lose his balance. Looks like he's well balanced. All right, I'm just gonna have you walk for me. If you will just walk. Perfect, and then turn around. If you'll heel the toe, walk for me. Perfect. All right. So my patient has great balance. He's not having any trouble with his walk. So the Glasgow Coma Scale, I would educate my patient on that. That's basically just that I'm looking for his level of consciousness, so he's able to open his eyes and close them. Verbally, he was able to talk to me and was coherent with his speech. Also, his motor movement was all as expected. So my patient would be a 15. That's the highest score you can get on that. If my patient were under a 8, that could mean that he was in a coma, and if he was a 3, that could mean he was dead or in a coma. So I would educate my patient on the Glasgow Coma Scale. Let's see, I believe that is the end of our assessment.